From the Lean Enterprise Institute in Boston, this is the WLEI podcast, where we share stories of people making the world better through lean thinking and practice. For more information about LEI, including how we can help you apply lean thinking, please visit www.lean.org.
I'm Matt Savis, host of What's the Problem, a podcast where we talk about problems. LEI has learned that successful lean transformation begins with a problem to solve. So that's what we're here to talk about, problems, from defining them to solving them. Let's get started. Today I am talking to Dr. Carlos Frederico Pinto, CEO of IOV, one of Brazil's top oncology clinics. In the podcast, I'll refer to him by his endearing nickname, Dr. Fred. There are few more important problems to solve than the one Dr. Fred and IOV are tackling, reducing the cancer burden. Dr. Fred walks us through 3 stages of transformation at IOV in service to solving that problem. First, improving patient care flow and quality, then spreading a lean management system to enable growth, and finally developing leaders in preparation for succession. Dr. Fred is emblematic of a lean leader, full of curiosity, humility, and resiliency, traits undoubtedly earned through his long, hard struggle to reduce the cancer burden. LEI is fortunate to have Dr. Fred as a speaker at its Lean Summit next April in Carlsbad, California. To register, head over to lean.org/summit 2020. Well, thanks for joining us on the podcast, Dr. Fred. I'd like to get started by asking, why oncology? Why did you choose to pursue oncology as a profession? And I ask because it's a point of difference. Of course, I am not an oncologist, but I could also never be one. My sister is a nurse in pediatric oncology, and through interactions with her, I've learned that I decidedly do not have the right stuff for oncology. I don't have the resiliency, I do not have the optimism for that kind of hard, challenging work. So why? Why oncology? Why did you choose to pursue that?
Hi, Matt. Thank you for inviting me. And well, I agree with you. Oncology, nursing, and pediatrics is very challenging. But when I was in medical school, I really enjoyed to interact with patients and to take care of patients that had chronic conditions. And at that point, oncology was very challenging. There's a lot of science behind oncology as well, like new drugs, mechanisms of actions of new drugs and drug combinations, and upfront new tests and genetic testings. Actually, as I'm growing older, I'm not having the chance to participate on this very new stuff going on because I'm spending most of my time now managing. But at that point, I was very interested in this kind of challenge. So that's how I jumped into oncology. And I really like it. I really like it.
So a mix of caring for patients and also cutting edge science. So the mission that you and IOV have, as you've defined it, is, I think, well, not just me, but I would say the world would consider hugely important. You describe it as reducing the cancer burden. What do you mean by that?
Well, that's the mission that we set up like more than 10 years ago, I think, almost 15 years ago. They said, well, everyone is touched by cancer. I mean, everyone has a friend, a parent or a grandparent or like a cousin that is touched by cancer. And the cancer burden is heavy. I mean, it has huge financial impact in families. It's huge social impact in the way of living. And I mean, it's a killing disease. People die of cancer. Cancer is the second most important cause of death in most part of the developed world. So reduce the cancer burden it's a great challenge. I mean, there are a lot of things a lot of stuff we can do to fight cancer by reducing its burden. Sometimes you cannot cure cancer, but reduce burden it's good enough.
You know, at some point along the way, in service to that, like you said, hugely important mission of reducing the cancer burden, you came across lean thinking, and for whatever reason, it occurred to you that this could help solve this problem. Can you tell us a little bit about that aha moment when it occurred to you that here's a way of thinking, here's a way of managing people and organization to solve this very hard problem of reducing the cancer burden?
Yeah, it was like 10 years ago that we were involved in trying to improve our system. We work in an organization that it's also serving the private healthcare system and the public healthcare system in Brazil, and we have different challenges. It's all challenging, but different challenges. And we were involved in trying to provide a good and high quality care for our patients, for our customers, reduce the cancer burden independently if you're private or public care system. So at that point, we were facing a lot of challenges about huge queues waiting like months to get access to cancer treatment. We had problems with the quality of care provided to patient, disconnection of care to our patient. And we started thinking about, well, we need to improve quality. And the first move we did was move into a quality program. I mean, like certifying our practice to a quality system. But when we were working with that system, I figured out that the aha moment is that, well, I'm just doing paperwork. It sounds like I'm wasting my time here. And the waste and healthcare idea came to pop up in front of me. And then I waste and healthcare sounds like lean. So I got into the white paper from IHI from 2005, Going Lean Healthcare, that it's a James Woolman white paper was involved at that point. And that's when we started our journey.
So you started off with entering or participating in some sort of quality certification, recognizing that, okay, it looks like I'm doing a little bit more paperwork than actually caring for patients. The queues are still there. The quality is not improved. And you come across a white paper that describes the application of lean thinking to healthcare. And for whatever reason, that triggers you to think, okay, here's something a little bit different. Here's something that sounds more, that sounds closer to actually eliminating the burden associated with cancer and serving patients who are suffering from it. In our conversation, actually just a few minutes ago, preparing for this podcast here, you kind of walked me through a series of transformations that you led through your organization. And you said it started with flow and quality. What does it mean when you say you started with flow and quality at IOV in service to this mission of reducing the cancer burden? What does that mean for the patient, flow and quality?
Well, flow is about, at that point, was just about reducing waiting time to get access to care. But we figured out that we could improve flow in different ways and in different, there are different flows in healthcare, and we started working to that because waiting time always a poor flow at the end also translates to poor quality, especially when you're talking about cancer. Waiting time is vital for treating cancer with success. I mean, to being successful in treating the patient, you need to do it fast.
The highest success rates are with patients who find the cancer early.
Get access faster, earlier.
So reducing the wait time from knowing a patient has cancer and treating it. That's would you say that's the most critical thing in terms of providing a successful outcome for a patient? Yeah,
it's one of the most important. I mean, not the only important, but there are also other issues. But when you think that you got cancer, you want to see a doctor immediately. And if your doctor say, oh, maybe it's cancer, you want to do a biopsy or whatever as soon as you can.
You want to find out.
Yeah, you need to figure out that fast. I mean, you're fighting for your life, and that's true most of the time. So, and that's the burden of cancer as well. I mean, you're facing death. That's the real idea behind when people think about cancers, that they're facing that. It's not really true for most people now, but if you don't get access, it can turn out to be like, this can be a really heavy burden to carry.
So part of that is not just the flow is not just about improving the success rate, but also relieving the stress, the mental burden of
the mental burden.
A patient who thinks, oh my God, I could have a real problem here, and the thought of having to wait to get access to care, I can only imagine that must be a sort of in some cases a debilitatingly stressful experience. So when you talk about, you're tying flow and quality together, they're sort of one and the same. If you can provide shorter lead times to patient care, that leads to better quality outcomes. Is that what you're saying?
That's the straight line about it. Yeah. So when we were talking about quality at that point, and then we figured out that we had to think about flow as well. And understand quality, flow, capacity, and demand is understand about stability. So we just got into that idea and started working. At that point, I just got John Shook book, Learning to See, and well, let's try it. Let's do it.
Okay, so you got a copy of Learning to See, and you yourself led some value stream mapping exercises. Can you tell us specifically what was the before condition that you were faced with, and what was the future condition that you managed to achieve?
Yeah, like I had one big issue for us was about breast cancer. If a patient got into the hospital with a breast lump, it would have to go to a breast doctor, and the breast doctor would ask for. And I would like do a physical exam and ask for a mammogram, and then an ultrasound, and then come back and then ask for a biopsy. And we figured like, well, it was in a public hospital where most women had to come from distant places, like 30 to 60 miles away from the hospital, driving like all night long, or coming with a public transportation, whatever. At that point, and it would take like almost 3 months to get into to real treatment, not just doing some exams and tests. And when we figured out the way that when we figured out the demand, and we figured out that, well, we have like 10 patients like this per week, so we can see 10 patients in a single day. Yes, we can. We can ask the breast doctor to see those patients for us. Yes, we can. We can have mammograms, 10 mammograms for a day. Yes, we can. We can just do like 10 biopsies in a day. No, we can't. But we didn't need 10 biopsies at that point. We actually needed 5. So at that point, we created a continuous flow for breast patients with breast lumps. That we said, well, if you have a breast lump, come here on Mondays. Don't come on Tuesdays nor Wednesdays. Just if you need a breast doctor, he will see you next Monday. And at that point, she would end the morning with the doctor, the mammogram done, blood test done. And by the end of the day, she would have also a breast biopsy. So that's improving flow. So that's what we're talking about, flow.
Previously, that patient may have had to make multiple trips across however many miles just to get to the clinic to have those tests done. Now, that patient could go in and one day receive all of the necessary procedures that were required to make a diagnosis and not have to worry about waiting many months or making multiple trips. So is there a particular patient that comes to mind when you think about the impact that had on the quality of the patient experience?
Yeah, I have a lot of patients that say, well, that was, most of them got terrified early in the morning and say, why they're taking care so fast? Maybe I'm dying of cancer. The first time they figure, oh, maybe I'm dying. And then we have to figure out ways to tell them, no, we're not dying. We're just trying to make it faster for you, so you don't have to come and go all the time. But we made a lot of difference for patients that were younger, because we know that breast cancer in younger women is more aggressive, more challenging to treat. So we made it faster. We made it earlier, and I remember at least few patients that we were able to avoid a mastectomy. So it's really worthwhile. It's great.
Life-changing, life-saving or life-changing experience for those patients. So in terms of the number of patients you were able to treat, I mean, roughly, do you know you were able to go from so many patients treated before this transformation to? It sounds like you must have been able to treat more patients after that.
So that the breast cancer challenge was one different challenge from the rest of what we were doing, because when we started doing it was like an overgrowing problem. I mean, we figured out that, well, we have a flow problem, we have to improve it, so let's improve it again and improve it again. And from certain flows, we had like 3 different value streams in a year for the same problem, because we were improving all the time. And in some ways and some patient flows, we were able to almost more than double the capacity that we were offering care with the same resources, actually with the same facility, the same amount of people working there, the same amount of doctors. We figured out some ways to make doctors' appointment more efficient and to create a really value-added appointment for doctors. And so we were more able to provide appointments, because patients, from time to time, patients get into a doctor and just the blood test that was most important was not ready, or just the biopsy was not ready. Oh no, you had to came here after you got your mammogram, not before, because the appointments were not connected. And some patients were coming from other cities and they had problems with their own agendas out there. So the scheduling there was not planned with our scheduling. And we figured out ways to plan a comprehensive scheduling system for our patients that almost doubled our capacity.
Well, planning around the patient rather than planning around
not planning around the schedule of doctors.
Yeah. That's one part of, or one piece of the transformation that IOV has gone through. Another piece that we spoke about was this piece about growing. And so IOV doubled in size over the course of one day, going from 3 facilities to 6 through was it a merger, or were you acquired, or?
Yeah, it was a mix of both. It was like an overnight change. I woke up one morning and we just doubled, because actually it was not one morning we doubled. I mean, but we merged it with 3 other facilities, and it took us like more than a year to make an agreement, and one day to move forward.
Yeah. Once it's ready, just flip the switch and it's
just switch it and it's gone. Yeah. So at that point, we were doing like some good work with our practices, but we had to make it work with the new side of our organization, and it was a real challenge. I mean, I had to take my leaders and people that I've been working for a while and move them to a new facility and figure out a way to make it work there. I mean, we're doing some lean here, so let's do some lean with you too. But it's not just copy and paste. So we had to learn a lot. And at that point, we started to struggling with our growing problem.
And wait, there was another shift. So first there was the shift to patient-focused scheduling, flow, and quality. And then a second shift, moving from a vertically driven organization to a horizontally driven organization. And I was struck by an interview by one of the value stream managers at IOV, who she said she had worked in a vertically driven healthcare organization for 21 years and experienced the transition to horizontally driven. And she described it as a remarkable achievement. And what is remarkable about that? What value did that deliver to patients in service to this larger objective of reducing cancer burden, moving from vertically driven to horizontally driven?
So when we were in this growing challenge, we had to grow to deal with a lot of new silos. And at that point, we figured out, we cannot deal it with the same way. We don't know how to do it. We have to learn about it. And so I asked help from a close friend now, from Flavio, from the LIM Instituto Brazil. And he came to work with us for a few months to help us make a transition. But the idea behind that is that, we all are looking for the patient needs and the cancer burden. So we need to just figure out how to solve patients' problem and think about the flow about patients. So we moved the manager of pharmacy, the operational manager, the manager of nurses, the doctor leader into one figure that is the flow manager. And the flow manager had to struggle with the leaders of other areas. And they kept struggling all the time. Actually, it's very challenging. And they keep struggling up to these days. But they are now understand that this struggle is about the patient's flow and has nothing to do about power or leader or who is on command or whatever. It's not about. It's just about patient. It's to see the patient flow, what we used to say here, from door to door all the time, and understand what's better and what's the easiest and safer way to make it work.
So a patient over the course of his or her treatment experiences a series of different functional silos, and thinking about how to not organize the organization around those functional silos, but around the actual patient experience, and introducing a value stream manager who, are you saying that person is responsible for coordinating those respective functions so that they're delivering a high quality patient experience?
This person is responsible even for the cleaning of our facilities, for the food we serve, for the reception desk, for the coffee, for whatever. I mean, she's looking for that. I mean, the problem she has to look after is the patient getting the quality we are saying that we can provide for him. And at that point, it's safe. How can we improve that? And we also created several trans-functional themes to solve problems. So we teach it and learn it about working together from different functions, looking for different perspectives of a single problem. And I think that was the most challenging and the really breakout about it.
Well, yeah, let's maybe dig in a little bit to some of the challenges of that. I mean, where did you experience failure along this transition from vertical to horizontal, and what did the organization learn from that?
We fail all the time, so that's one reason. Fortunately, we are not failing with the patient's safety, so that's the real issue. I mean, we're providing safe care and good quality care, but we fail all the time, and our fails are far from the patient, and we create a system that it's safe enough that we can provide safe care, but not perfect system. But some failures were very, very unpredicted for us. I mean, we were working with daily management in one organization, and the ones that we were used to, and then we double size it, say, well, let's do some daily management here, because we are working with this for a few time, and maybe we can just introduce. And it was a real failure because they were they were not used. The new facilities that we acquired, they were not used with the daily management, with the idea behind daily management. And we started to doing that. He started to fight during the huddles. So it was a real failure. We had to draw back and reframe everything and think about it.
Why don't you think they were ready for that?
It's about culture. It's about understanding to see problems and talk about problems and not pointing fingers on problems.
So what is intended to be a conversation around how to solve problems that have arisen over the course of the day or previous day turned into finger pointing and fighting.
Yeah.
And how am I correct to say that organization is now successily
they're doing quite fine. Mm-hmm. Yeah, they're doing quite fine. I mean, they're doing huddles everywhere and all the time. It was very naive to figure it out that we could just plug and play something there, but we tried.
And what do you think happened along their learning journey that allowed them to go from finger pointing to problem solving?
Well, thinking about problem solving first, and had the chance to go on problem solving smoother, and it has a lot to do with the leadership behavior. So at that point, we got into another challenge that was understand how to develop our leadership.
Yeah. So you have expanded quite a bit of your efforts. You're a busy guy, Dr. Fred. We talked about this. You're busy traveling all over the place. IOV having become such an example. Others are visiting with some frequency to learn from what you and the team has done. And you also have expanded what you're doing beyond the walls of IOV to include other hospitals around Brazil. And so we talked about, your realization that IOV cannot be dependent on you. It needs to be able to work without you there. And so, can you tell us a bit about that last piece of that last big problem, leadership behavior, and how you have worked to build capability beyond yourself?
So when we had that when we struggled with the huddles in the new facilities we got, we figured out that the problem was the leadership, not just about doing something. It's about leadership behavior. If you have like a punitive behavior, you will have people pointing fingers. So we had to change the way leaders behave before changing the whole system, and we started to work on our leadership. And at that point, I had the clear vision that I would not be here forever, and I want IOV mission to be fulfilled longer than I can be there. So we started to work with the leaders of our organization, and we created like a training system for leadership with leaders, coaches, and trainees, and doing stuff all the time on Gemba. No classroom, no PowerPoints, just Gemba training on leadership. And then we started to do the same stuff with other organizations that we work with. We have some, like being the public system here in Brazil, we have contact with a lot of public hospitals and public facilities, and they asked for help. So we started working together to develop these content with them, and we've been doing it like for 3 years now.
Well, that's another important piece to this. So in reducing the cancer burden, that great mission, you're now working more closely with the Lean Institute Brazil, which is a member of Lean Global Network, an affiliate institute with Lean Enterprise Institute here in Boston. Shares the same mission as LEI to spread lean thinking and practice in Brazil, and you've been donating your time to help hospitals do what IOV has managed to do, which is to improve the quality of care they deliver to patients and the number of patients that they can treat. Are you encountering challenges that you did not face at IOV in that experience?
Well, in different conditions and different sources of problems, yes. But from the people side, I think it's all the same. I mean, we are now working with a 400-bed hospital that is a big, huge emergency. They see like 20,000 patients a month from the emergency department.
Oh my God.
And we've been working with them like 3 years now, and they've been improving a lot of their flow and the quality they're providing to their patients. They're saving a lot of lives. But from the organization side, size, bigger issues, more complex system, bigger problems, well, just about size. But from the people side, it's exactly the same behavior. It's exactly the same understanding about. And what we figured out at this point is that they're doing quite well because they change it the way they understand problems and think about problems. I'm working with another hospital that is a smaller hospital, but a huge emergency as well. They see like 23,000 patients on emergency department that month, and they're facing the same challenges. They're facing leadership behavior challenges. They're doing quite well. They're doing like some huddles, some training, some value stream mapping, but they are always the wall they hit is leadership behavior. So I think that we're now spending a lot of time thinking about how to make better leaders more prepared to deal with the failure of the system, with personal failure, with trying to and understand that failure will happen most of the time. I mean, so we don't want to fail with patients, but we will fail in the system, and we have to learn on this.
So failure not as an opportunity to blame somebody, but as an opportunity to learn something.
To learn, to learn, and this behavior is what we need, because we got into discussions and we go to Gamba, and like assistant nurse is telling, oh, we got this problem, and the leader, no, we don't have this problem here, and she's saying that she has the problem. So it's about the behavior. It's not about the problem. I mean.
Did you ever early in your journey, did you ever think to yourself that your behavior needed to change with respect to that? Or have you always naturally been seeing opportunities, problems as opportunities for learn? Or did you yourself have to undergo reflection and change?
Well, maybe you're driving me back to the first question you asked me, why I am a medical oncologist. Because we are very used to fail. I mean, oncology is a specialty that we lose patients and lives, and we are very resilient to that. We need to understand that we're talking about reducing the cancer burden, but we cannot save everyone. So we have to be resilient with failure. I had to learn about that, being a resilient doctor on failing with some patients, and it's not my fail, it's about the disease. But being a leader and understand that people will fail from time to time because they cannot be perfect all the time, and have an appropriate behavior on that failure is something that I had to learn, and it took me a long time to actually, I'm still learning. It took me a time to understand, but now I can understand, but I'm still failing.
So the nature of the job, and you're saying the job breeds in you a resiliency.
Yeah.
With failure, and so But your reaction to it has not always been the same. And so...
No, I've learned a lot about how to react. And that's interesting because when you're an oncologist, you have to have a clear understanding about what the goals about what the treatment you're offering. And from patient to patient, I mean, well, maybe I cannot cure you, but I can make you live longer enough to see your daughter have a child or get married or graduate. So you set a point in time like a goal, and it's a way to reduce the cancer burden and to manage failure in a different way. So that's about the learning that I bring with me from being an oncology, a cancer doctor.
I can't think of anything more important than that. And, very thankful that there are people like you out in the world, Dr. Fred, who are, helping people who are suffering, as you say, reduce that burden. And so thanks, Dr. Fred, for joining me here on the podcast. It's been great.
Oh, thank you as well. It was my pleasure. Great to talk to you, Matt.
Thanks to Dr. Fred for speaking with me today. Always a humbling experience. Another thanks to Emma Ripp and Lori Moniz, the producers of WLEI, and thanks to you for listening. If you have a problem that you're tackling and that you'd like to share, send us an email at pod@lean.org.